Welcome back. It's estimated that more than 150 people die every day from overdoses related to synthetic opioids. Researchers say there's a new group of drugs that's making the problem worse. Mandy Gaither explains the dangers of these new drugs and why researchers say people need to be aware.
A new warning about an emerging group of powerful and dangerous synthetic opioids discovered in the U.S.
This is something that just a year and a half, 2 years ago was not in the drug supply at all.
In a study published this week in JAMA Network Open, Dr. Alexandra Amaducci and other researchers say nitazines are a synthetic opioid like fentanyl, but have a different chemical structure.
They're just much more potent, meaning that someone may not know that these chemicals exist and they use the same amount of a drug that they've always used and they have an unintended worse effect.
Fentanyl has been involved in more than 2/3 of all overdose deaths in the U.S. It's up to 50 times stronger than heroin and 100 times stronger than morphine. The new synthetic opioids appear to be even more potent. The study suggests they may be associated with an increased rate of cardiac arrest when people overdose.
The drug supply is always changing. It changes month to month, year to year, and it's much more dangerous.
Amaducci says new synthetic opioids are a growing problem. She says the U.S. drug supply isn't clean and people may think they're taking one drug but are consuming multiple substances instead. She says the public needs to know these new potent drugs exist.
It's also important for our providers, our police, our EMS, our firefighters, our emergency department, physicians, that these patients may require a higher level of care and more doses of naloxone or Narcan.
For Health Minute, I'm Mandy Gaither.